Okay, good morning, everybody. A little different way to do this than normal. I hope that everybody's doing well. I'm sure that you are very busy, or most of you at least. I am going to try to touch on how we got here today through the governor's orders, and then touch on the federal laws in a very brief way, since the CARES Act, it's not even out there, none of the regulations or guidances yet. But in any event, as John said, you can print the handout it's on the right side of my screen. Hopefully that's where it is on your screen, and also send your questions over and we'll try to deal with them at the end. Next slide, please, John. So the governor she acts through her executive orders, and she declared a state of emergency in Executive Order 4, and then immediately thereafter entered Executive Order 5, which was the temporary prohibition on large gatherings. She closed the schools initially from March 16th to April 5th, limited gatherings to 250 people. That's been expanded upon. She rescinded Executive Order 5 with Executive Order 11, which brought gatherings down to no more than 50 people, closed all school buildings until April 5th, and excluded essential services such as healthcare facilities, which affected probably many of you, grocery stores, private manufacturing facilities, and other things. She entered Executive Order 9, which on March 16th, which was intended to last until March 30th, which closed restaurants except for takeout or delivery, all recreational type things, fitness places, casinos, theaters, libraries, museums, and that order was rescinded by Executive Order 20, which added a bunch of other facilities that closed. As she became aware of places where people were gathering, she added them to her order. That initially closed things from April 1st to April 13th. That was expanded upon by her most recent order, which closed everything down, loosely saying everything, until April 30th. So that's where we are today. She also entered orders, a couple of different orders that expanded unemployment. I don't know if those orders are affecting many of you because you are in the medical field that are considered essential businesses. So you're probably, most of you are still operating, but that's been a big issue up here. Many people have been laid off all across the country, particularly in the state of Michigan, and her orders have greatly expanded the unemployment system to include people that normally would not be eligible for benefits. So if you have had to lay people off, I just wanted to alert you to the changes that are out there. The system now covers anyone who had to leave work due to medical reasons related to COVID-19, which means they either had it, were exposed to it, and have to do the 14-day quarantine, or they need to, I think even if they had to leave, I'm not positive if it's to take care of people. Unemployment may not cover that, but it's pretty broadly covering people that have their own medical reasons to leave work, which normally would not be covered because they could not say they were out there seeking employment and ready and able and willing to work. She expanded benefits from 20 to 26 weeks and expanded approval of work share programs. I'm not sure if any of you are familiar with that. I now know more about it than I would ever want to, but it's not related to this COVID-19 crisis. It's always been out there. And a work share program is available to employers who have a downturn in the amount of work that they have, and they want to keep their employees on, but they can't keep them employed full time. So you might reduce hours, you might create job sharing situations where two people share a full 5 days worth of work. You could have people work 1 week on, 1 week off. There's various ways to handle it, but in any event, if you want to do an official work share program, you register with the state and provide the hours, I think, on a weekly basis, and the unemployment system will pay the employees for basically their downtime if you're a registered work share program or employer. And under the executive orders that are out there, the work share programs are the requirements were loosened, and they're trying to approve everything they can. I don't even know what the requirements off the top of my head were, but in any event, they're encouraging that, really, because one of the purposes of work share programs is that employees are expected to stay with their employer and not be out there looking for work, which is the situation most employers are in right now. They don't want to lose their employees. They just can't keep them working full time. And that's another thing that she did with these expanded unemployment rules. If the employer goes on and registers with the site, and it's not through WorkShare, just in their normal unemployment account, they can indicate that the employees were laid off, expected to be temporary, and then the employees do not have to call in every 2 weeks and certify that they're still laid off and that they're able to look for work and are looking for work. So that's a big benefit to everybody under this expanded unemployment order. And the final thing that's really beneficial to employers is that the state is going to pay the unemployment benefit for anyone who's laid off related to COVID-19 reasons. So it will not be charged against your account. So I had employers that were hesitating to lay people off because of the huge expense on the other end to their unemployment rating, but the state is picking up their cost of the state cost of the benefits, and it will not be charged against the employer. So you need to be aware of that fact, and I'll cover the federal changes to unemployment a little bit later. I'm going to run through the state changes first. So Executive Order 2020-24. Okay, sorry, I'm doing these out of order because I tried to keep them topically correct. So it rescinded and expanded the provisions of the original order regarding unemployment. Persons leaving work for most COVID-19 reasons qualify for unemployment. The initial order went to March 30th. It expanded it to April 22nd. It expanded the filing deadline for laid off employees to seek unemployment from 14 to 28 days. Under the normal system, they have to register within 14 days of layoff, and they're eligible for 20 weeks of unemployment. Now they get 28 days to register, which I hear is a good thing. If you do lay people off, encourage them. There's a whole alphabetical system set up by the state to try to address the issues they're having with the influx on the system. It's having a difficult time letting people in. So the best time to call is the middle of the night, and everyone I know who calls after 8 p.m. until about 2 in the morning has had a much easier time getting in than if you try to call during business hours. So they have the expanded time to file, and again, the state will pick up the cost. EEO 13 loosened the regulations on healthcare licensing and allowed more flexibility on temporary medical facilities, and that's good. That order lasts until April 14th. I don't I believe that was extended by a subsequent order, but I did not have the number. EEO 16 loosens licensing for child care centers. This one may have affected all of you. EEO 2020-17 put temporary restrictions on non-essential, medical and dental procedures. It was put into effect March 20th, and this one did not have an end date. It is in effect for as long as the state of emergency is in effect. So until the governor declares that the state of emergency is over and things can start to go back to normal, this restriction on non-essential medical and dental procedures will be in place. It bans any procedure that is not necessary to address a medical emergency or to preserve the health and safety of a patient, and that determination is made by the medical professional. So it's up to your doctors to decide if it's necessary. Specifically excluded from the ban are you're allowed to do necessary cardiovascular surgeries, oncology procedures and treatments are still okay, pregnancy-related visits are okay, organ transplants and procedures related to dialysis. And this is not limiting, but this is just clearly allowed, and then anything else that healthcare providers determine are medically necessary right now can be, those visits are fine and those treatments. This was the big stay home, stay safe order, the first one. Executive Order 21, it was a temporary suspension of activities not necessary to sustain or protect life. The order, the governor ordered people to stay home from March 24th through April 13th and practice social distancing if you left home. That same order prohibited gatherings of any people who were not members of a single household. People were only supposed to leave home if they're a critical infrastructure employee, such as probably most of you and your employees. Critical manufacturing, grocery stores, medicine, emergency medical or dental care is an allowable reason to leave home. If you had to care for elderly persons, minors, disabled persons, pets that were in another household, people were allowed to leave home for those purposes. That order allowed travel to return home from or go to another state. It allowed travel between two residences in the state of Michigan, which has been a big issue. I know that Traverse City is feeling the same way we are up here, that we're very worried about an influx of the seasonal residents bringing disease with them and taxing our systems. But under the original Executive Order 21, that was allowed. People are allowed to transport kids to fulfill custody agreements, and workers in healthcare and public health and those who perform necessary governmental activities were defined. Those are the workers who are critical infrastructure workers and were allowed to travel. Executive Order 25 gave pharmacies temporary flexibility. They could renew expired prescriptions and or give 60-day refills. The governor ordered that insurance companies have to cover those refills, and it allowed some remote supervision by pharmacists to expedite filling of prescriptions. Next slide, John, thanks. Executive Order 33 expanded, I believe the original Order 4 was a state of emergency. 33 rescinded that and instead put in place this executive order on April 13th that declared an emergency and a state of disaster. Declared a state of emergency and a state of disaster across the state of Michigan. And that, I believe, was for purposes of opening up additional help from the federal government and allowing activation of the National Guard to help with wherever needed in the state. This order lasts until the emergency and disaster conditions no longer exist, and until appropriate programs have been implemented to recover from any effects of the statewide emergency and disaster. So this just gives her power to put in place what's necessary to keep things going as best as possible during this crisis. Executive Order 30, basically, it was called Temporary Relief from Restrictions on Providing Medical Services. This expanded the ability of medical personnel to provide services in a healthcare facility, so hospitals and particularly, I think, nursing homes. It let people do jobs maybe outside of their licensing if they have the experience and skills to do it. It's sort of an all hands on deck ability to get the work done. Executive Order 35 suspended K through 12 schools, sports, extracurricular activities through the end of the school year, and ordered schools to work with 12th graders to get the credits necessary to graduate. Excuse me. This is a fairly recent one, and this is a big one for all of you to know about. Executive Order 2020-36 gave protection to employees who want to stay home or who do stay home when they're sick. It says that employers can't discharge, discipline, or retaliate against employees who stay home because they tested positive or have principal symptoms, or they've had close contact with someone who has tested positive or has the principal symptoms. And the principal symptoms are defined in this act as a fever, an atypical cough, or atypical shortness of breath. If you have employees who have the symptoms or have tested positive, you have to treat these employees as if they were on medical leave under the Paid Medical Leave Act, which is the Michigan law that went into effect last year. It might not generally cover most of you because you have to have 50 employees to be covered by it. But this executive order says that you have to treat the employees as if they were on a medical leave that's allowed under the Paid Medical Leave Act, even if you don't have 50 employees. The difference is that you don't have to pay them. Under the Paid Medical Leave Act, they have to be paid if they're off on medical leave that qualifies. Under Executive Order 36, the leave can be unpaid. It's up to the employer, not the employee, to decide if you can allow the employees to use their accrued PTO to cover these this time off work. And as an aside, remember, if they are off work for 14 days and aren't being paid, i.e. allowed to use their PTO, they would qualify for unemployment for those 2 weeks until they could come back to work again. So employees who test positive or display symptoms, this executive order says they have to stay home unless they're permitted to leave, which that qualifier applies to you, so we'll get to it. But if in general an employee must stay home unless permitted to leave until 3 days have passed since their last symptom and 7 days have passed since the symptoms appeared or they were swabbed for the positive test. Section 3 of the Act says that they have to stay home if they have close contact with an individual who tests positive or has principal symptoms until 14 days pass since the last contact or that person got a negative test. So Section 2 of this order deals with them testing positive. Section 3 deals with them staying home because they have close contact. Close contact is defined in the Act very specifically. I think it's like spending 10 minutes or more within 6 feet of a person, something like that. You could look, as an aside, all of these executive orders are on michigan.gov. Click on the COVID resources, and it's pretty easy to find your way through the site, and every one of the orders is linkable and very easy to find and very easy to read. So if you want to know what some of these definitions are, if I don't cover them, you can find them on the government website. So this section does not apply to healthcare professionals, workers at a healthcare facility, first responders, child care workers, if their employer's rules governing occupational health allow them to go to work. So it applies to everyone except these particular categories, and it may apply to these people, but there are different rules out there governing when it's okay for a healthcare worker to go to work, and the healthcare workers should be following those rules, not necessarily this order. But so this order protects against discrimination or retaliation, but there's two caveats to that. If an employee violates Section 2 or 3, they've been exposed or they have it, or they've been exposed to someone who has it, and they come back to work and don't stay home for the waiting period, they don't have any protection. You can fire them, discipline them, whatever, because they are violating the act. And the second thing is, if you have employees who are not protected by Section 2 or 3, either they are not sick and don't want to come to work, or they have waited out the waiting periods and don't want to return to work just because they're afraid they're going to get it, they're afraid of being exposed to it, whatever, they're not protected by the act either. So if you have employees who are setting their own rules that don't meet the guidelines in this act, they're not protected by the act. And there have been a lot of instances that I've had a lot of phone calls, especially initially, about people who work in essential businesses but just don't want to come to work because they're kind of freaked out about it. They don't have any right to do that. If the employer has work for them to do and expects them to come to work, and they haven't been exposed to the illness, they're just afraid of being exposed, then you can terminate them, you can discipline them, and they don't have any protection. And they also would have a harder time getting unemployment, because being afraid of getting COVID-19 is not a reason to be leaving a job. Next slide, John. Executive Order 42 rescinded Executive Order 21, the original Stay Home, Stay Safe order. This one expanded the staying home provisions until April 30th. It requires people to stay home. It prohibits any gatherings unless the people gathering reside in their same home. It allows funerals if there are 10 or fewer people in attendance. People are only supposed to leave home for absolutely necessary basic needs. They are no longer supposed to travel between two residences within the state. This is aimed at keeping people in place and not the seasonal residents not bringing potential disease up here. It put additional guidelines in place for limiting how many people can be in a store at one time to further the social distancing rules. It also required some big box stores to actually section off portions of the store that weren't determined to be necessary. It ordered stores to create special times for vulnerable citizens to do their shopping. I think in some ways it put in place what was already happening out there, but it must not have been happening across the board. So this puts in place requirements that stores do that. and just a couple notes on that last order that were not on the slide. This is the one that's really controversial because people want to take their boats out, so that got loosened up. But I think it's still no motorized boats, and you can't be in a boat with someone that you don't reside with. So again, trying to limit people to the circle that they're already in and not have exposure to other people until they can figure out how we can all interact safely. People are in an uproar about golfing. They loosened that up to say if you belong to a private club and have already paid your dues, you can go out there, but nobody's going to be out putting flags in or checking on you, those kinds of things. The things you're reading in the news now are as a result of this order, and this is in place until April 30th. Next, John, thanks. This one I thought might be of interest to you. It's Executive Order 47. This is the most recent, her last order. It temporarily extends driver's licenses, state IDs, and vehicle registration. So if you have a driver's license or a state ID that expired between February 1st and May 31st of this year, you will not be penalized if you renew it by June 30th. They're giving that extension of time to renew. And vehicle registration's the same thing. If it expired on or after March 1st, you have until June 30th to renew it, recognizing that you're not supposed to be going out of the house. So for a lot of people, that would be hard to get their renewals. Okay. And here is another typo. I'm really sorry, you guys. It's the FFCRA, Families First Corona Recovery Act. This is the federal law. It was passed on March, I believe it was signed into, it was either March 23rd or March 27th. I think that this was March 23rd and the CARES Act was March 27th, but in any event, this took effect April 1st. Yeah, so it was signed March 23rd. It contains the Emergency Paid Sick Leave Act, and it contains an Expanded Family and Medical Leave Act. And I'm going to talk about both of those. There were other provisions in this statute dealing with all sorts of things, but I think from an employer standpoint and the business you're in, these are the two provisions that really matter to you. So the Emergency Paid Sick Leave Act probably, well, let's just go through it. It applies to all of you, but you have the opportunity, the ability to exempt yourself from the act. This act allows for 2 weeks or up to 80 hours of paid sick leave for one time only. It requires you to pay for the amount of hours the employee would normally work if they qualify for this leave at their regular rate of pay. So if you have employees who are 32-hour-a-week employees, they would only get 74 hours, not 80 under this. It applies to part-time employees, but again, you would prorate their regular hours to determine how much paid sick leave they would be entitled to in a 2-week period. And if you have employees who work more than 40 hours in a 1-week period, they would still be limited to 80 hours. So they might work 50 hours in 1 week, 50 hours the next. They'd get paid sick leave of 50 hours in the first week and 30 in the second. So people are eligible to take this leave if they are subject to a federal, state, or local quarantine or isolation order related to COVID-19, if they've been advised by a healthcare provider to self-quarantine due to concerns related to COVID-19, or they are experiencing symptoms of COVID-19 and are seeking a medical diagnosis. So these are the first 3 reasons under the Paid Sick Leave Act that employees could ask for up to 80 hours of paid sick leave. And if they ask for one of these 3 reasons, they get either their regular rate of pay or the highest applicable minimum wage, which would be Michigan. It's higher by a couple dollars over the federal minimum, up to a maximum of $511 per day or $5,110 total over the entire paid sick leave period. There are 3 other reasons that they can ask for this leave, and that is caring for an individual who's subject to a federal, state, or local quarantine or isolation order related to COVID-19, or an individual who's been advised by a healthcare provider to self-quarantine due to concerns related to COVID-19. So the first, to get full pay, they have to be sick themselves or subject to an order themselves. Under this provision, they have to be, they're allowed to get paid sick leave for caring for someone else and or caring for kids who are off school because their school or their child care provider is unavailable or closed. And if they take, can you do the next slide, John? If they take sick leave for those reasons, and the 6th one, I don't know what this is. I think it's to give discretion for federal employees because they are experiencing any other substantially similar condition that may arise as specified by Health and Human Services. So if they, next slide, John, if they take it for the last 3 reasons, they're caring for someone else, they're caring for their kids, then they are paid at 2/3 of their regular rate of pay or the highest applicable minimum wage with a maximum of $200 a day or $2,000 over the entire 2-week period. So next slide, please. And the same with the expanded family and medical leave. So the original Family Medical Leave Act is still out there. They tacked this provision on. The Families First COVID Recovery Act expires on December 31st. So this paid sick leave provision and this particular section of FMLA both are only in effect from April 1st until December 31st. So under the emergency FMLA expansion, they can take 12 weeks of family and medical leave to care for children who are home with no one to care for them because their school was closed and or their daycare was closed. This particular provision, the original FMLA rules apply to all other FMLA leaves. They're still out there. And if you are under 50 employees, you're not subject to it. But this one applies only to employers of less than 500 employees. And so it goes from 1 to 500. So even if you're not subject to regular FMLA, if you have employees that want to stay home to take care of their kids, you are subject to FMLA for these purposes, and they can take up to 12 weeks of leave. And there's a caveat to that, which I'll get to at the end of this, but I wanted to explain how it works first. So under the expanded FMLA, the first 2 weeks are unpaid. And so that's the purpose of the Paid Sick Leave Act. They both contain provisions that staying home for to take care of kids is a reason for taking the paid leave. So what Congress anticipated is that you would use paid sick leave, the 80 hours, to pay for the first 2 weeks of the FMLA, and then they would be out of paid leave time. And so this expanded FMLA leave has a provision where it's paid for the last 10 weeks. So the first 2 are unpaid, but they can use paid sick leave. Then they kick in the additional 10 weeks of FMLA, and they get paid at the 2/3 rate, the same as under the Paid Sick Leave Act. And if you have people who are going to take the 12 weeks and you're going to let them, make sure that you start their FMLA running when they activate the paid sick leave, if it's for staying home for child care purposes, because you don't want them to get 14 weeks. You want them to get 12 weeks of FMLA. And they don't have to use the Paid Sick Leave Act for the first 10 days. They can choose to use their accrued PTO. And it's kind of weird to think that they would just want to use their PTO and leave the paid sick leave out there. But the paid sick leave, they could use any time up until December 31st if they get sick. So you might have employees who want to burn their PTO and take care of their kids and keep that sick leave act, or keep the sick leave time out there in case they actually get sick or have to take care of someone who's sick. Next slide, please, John. So the same, the pay is up to $200 a day or $12,000 total under the Families First Corona Recovery Act for the entire 12-week period. And again, and even if they use the paid sick leave for the first 2 weeks, they're only getting 2/3 pay for that entire period because the leave is for childcare, not their own medical reason. They, if the employer chooses to, you can allow them to use PTO to cover the 1/3 of their pay, of their regular pay. So they get 2/3 pay under the Act. You can let them use PTO to supplement the additional 1/3. And I just want to bring to your attention that we talked about how under the executive orders, unemployment's not going to be charged to employers. The state is going to pick up that cost. Well, under the Families First Coronavirus Recovery Act, this paid sick leave and paid FMLA leave are going to be paid by the federal government, even though you're going to pay the money up front, but you're going to get it back if you have to pay any time under these acts. As an employer, you will recover all of that money from the federal government. So it comes out of your pocket initially, and there are ways to, it's more of an accounting function, and I am very upfront. I am not an accountant, and I'm not giving tax advice, but basically the way it works is this act put into place some rules that, as I understand it, allow employers to withhold. So you would do your payroll, withhold the federal income tax, withhold Social Security and Medicare, and then instead of submitting it to the government, you can use that money to pay for these leaves, and then it all comes out when you do your tax filings. Again, talk to your accountant about that, but in general, that's how it's supposed to work. So it's out of pocket, but it may not be out of pocket depending on how the numbers work out for you. If you send in a lot of payroll taxes and you only have one person using this leave that you have to cover, you may very well be able to withhold all, because it's all the payroll taxes you pay. It doesn't have to be directly related to this employee. So any payroll money you have going at the door for taxes could be used to cover these leaves. So that's something to talk to your accountant about. But up front, these laws may cost employers money, but when all of it is said and done, it should be covered completely by the federal government, other than the money you pay your accountants and lawyers to try to figure out how to do it. But the paid leave time will be paid by the federal government. Thanks, John. Next slide. But here's the kicker for all of you. The employer is allowed to exclude healthcare providers and first responders from taking this leave. And for purposes of this act only, the definition of a healthcare provider is very broad. It's defined as anyone employed at any doctor's office, hospital, healthcare center, clinic, post-secondary educational institution offering healthcare instruction, med schools, local health department or agency, nursing facility, retirement facility, nursing home, home healthcare provider, any facility that performs lab or medical testing, pharmacy, or any other similar institution, employer, or entity. And so it's anybody who works for you, from the receptionist to the doctors. So because your medical practices, you can say to someone who asks for leave, I'm sorry, we have to exclude you. We need all hands on deck. You can't take this leave. And I mean, from a practical standpoint, it's probably you should make as always, you should make your decisions based on job duties. You can put it across the board, no one can take this. But from a practical standpoint, you're going to let people take it if they're sick. You can't have someone at work with COVID-19. So even though you can exclude them, I don't think from a practical standpoint in a medical office that you're going to want someone sick. So you could put in categories like if you're sick and or have been exposed, then stay home and you can take these 2 leaves. If you're just staying home to take care of someone who's out of school, no, you can't take this leave. And then you have the category in the middle where they want to stay home to take care of someone who's been exposed. I don't know how that would work, but in any event, as a healthcare employer, you have the option to either allow these leaves or tell people that they can't take it. Just base your decisions on objective reasons, not subjective, and you should be okay. Can you flip the slide, John, please? Okay, here's, this just broadens who it reaches. The definition includes any individual employed by an entity that contracts with any of the medical facilities. So these definitions are out there if you want them, but just know that it's super broadly defined. John, can you do the next slide? So for purposes of this exclusion of healthcare providers and or emergency responders from the leave provisions of the Families First Coronavirus Recovery Act, it's the employer's choice whether to allow the leave or not. For anyone else, not a healthcare provider or emergency responder, it's the employee's choice. But for you guys, it's the employer's choice. And if you tell them they can't take this leave, you still have to allow these employees to take any other leave that they might have coming. So you could say you can't take paid sick leave, but if your PTO policies allow people to take sick days under your PTO, they could take their regular PTO and you would have to let them do that. And if they are sick with COVID-19, again, I think you probably have to keep them out of the workplace. But in any event, that also would possibly be, I'm not sure, but if they have a regular FMLA qualifying reason, which that might be, depending on the circumstances, then they would still be allowed to take regular FMLA leave. They just can't take it for childcare purposes if you choose to exclude your workforce from the act. And again, Department of Labor recognizes the concern of having people in the workforce who are sick, so they encourage employers to be judicious when using this definition, exempting healthcare providers and emergency responders. So if they're sick, they're telling you, even though you could make them work, don't. Next slide, please. Okay, the CARES Act. And this one is the act that was passed to try to pump money into businesses. It's very long, it's very complicated, and we haven't seen a lot of guidance yet. I think we're going to see many orders out there, or guidances or regulations released explaining how this is going to work. But right now, we kind of know the basics. And with the Families First Act, the Department of Labor issued in a short, like in 2 weeks before it came out, they issued about 3 guidances and about 75 question and answers to try to address issues they anticipated. And then they also issued a 140-page temporary regulation. And so we had a lot of information before it went into place as to how the Department of Labor was going to interpret and enforce the law. And in some cases, their interpretation looked very different than the act. And I would expect that that's going to happen many more times with the CARES Act as it goes along. So I'm just going to alert you to the basics of it, and there's way more to come on this act. So the purpose of it was to give emergency relief and taxpayer protections to pump money into the economy. It put aside $500 billion to provide loans, guarantees, and other investments in support of eligible businesses, states, and municipalities. They set aside $25 million for passenger air carriers, $4 billion for cargo air carriers, $17 billion for businesses critical to maintaining national security, and the remaining $454 billion is available to the financial system to loan out to eligible businesses, states, and municipalities. So they're funneling the money through the existing financial system, and you can go to theoretically, you can go to your banker and apply for loans or grants through the local bank that you have to get this money, and that's how it's intended to work. There's a provision in it that eligible medium-sized businesses, those between 500 and 10,000 employees, can get direct loans at 2% interest due to economic uncertainty related to the COVID-19 virus. Can you flip the slide, please, John? Excuse me. The Paycheck Protection Program provides loan forgiveness for retaining employees by temporarily expanding the traditional SBA 7A loan program. I don't know if this would apply to any of you, but if you have had to lay off employees, this is intended to help you bring them back and cover your payroll for a few months. I think it's up to 4 months. And it is a loan that can be forgiven based on a very complicated series of factors and formulas. But essentially, if you qualify for and get one of these loans, it's at 1% interest for 2 years if it's not forgiven. So it's pretty attractive money. And if you meet the requirements, it could be totally forgiven by the government, and it would be free money, basically. So if you are in a situation where you've had to lay people off and need money to bring them back, or could use money to bring them back, you might want to contact your banker about the Paycheck Protection Program. Next, John. It created an economic injury disaster loan. These are all through the Small Business Act programs, and I think that some or all of them existed, but they're additional funding. This is a loan, allows for a loan advance if you're applying for an economic injury disaster loan, and it will provide up to $10,000 of economic relief to businesses that are currently experiencing temporary difficulties, and it's my understanding this amount does not have to be repaid. So again, that's more like a grant, $10,000 in that form of a loan. Next, it created or funds express bridge loans, which enable small businesses who currently have a business relation with an SBA express lender to access up to $25,000 quickly. And finally, it has a provision for SBA debt relief. They're providing, SBA is directed to provide a financial reprieve to small businesses during the pandemic, and they will pay costs and interest for certain existing or new loans for up to 6 months. So again, I don't believe that has to be paid back. So if any of these sound like something your business could take advantage of, contact your local bank. That's how you get these loans. Next, the Heroes Fund. Jamie asked me to address this for you guys, which I can see why it would be of great interest to you. It was introduced April 3rd into committee, I believe, by Representative Huizenga, and it is a bill that will give you tax relief. So first responders would not have to count wages up to $50,000. Wages earned between February 15th and June 15th of 2020. Wages wouldn't be counted up to the max of $50,000 in your gross income when you do your taxes. And then if the pandemic or national emergency, or however it's defined, goes beyond June 15th, there's a provision where an additional, your additional income up to $12,500 a month would be added to that $50,000. So when you do your taxes, that income would not be taxable income if you're a first responder. First responders are defined as any individual who is a physician, nurse, pharmacist, law enforcement officer, corrections officer, firefighter, emergency medical tech, or paramedic that provides services in the county that has at least one confirmed case of COVID-19, or provides services in a licensed medical or care facility which is located in such a county. So I think it would it would apply to your physicians and nurses because they're in a county. I mean, Michigan has it pretty much in every county, I think. So anyway, this is something that will be more to come. It's been introduced at committee. I haven't heard anything more about it. It's the kind of thing that I would expect to see passed, but I don't know when, and I think there would be a lot of potential for it to be rolled into. There's a lot of talk that they are working on a fourth relief bill, and I would think this would be included in it. If that bill doesn't come about, I'm sure this will be pushed through. But again, I don't know when you could expect to hear any more about that, but keep your ears tuned, and hopefully it'll go through to help you guys. I think, that's our last slide. So John, I am not seeing questions. I don't know if anybody sent any in, but if you want to send them in right now, go for it. And if not, then I think we are done for today.
Yeah, just as a reminder, type your questions right into the questions widget on that GoToWebinar display on your dashboard, and we'll see them pop up. And we can just give it another minute and and then go from
Does
there.
it come up,
Go ahead.
John? Do you put it in where it says chat?
There's actually a questions area similar to chat. So look for the questions area.
Because I don't see that on my screen. So I'm just wondering if
Yep,
that's...
there's not, we don't have any questions at this point.
Okay.
Yeah, no, I think you covered off a lot, and I don't know that there are any questions. We can wrap it up if you want. I don't see anything popping in at the moment.
All right. Well, thanks, you guys. I know this is a heavy topic, and there's a lot of information out there. If you have questions,
we have a
let
couple
me
questions,
know.
Laura. Laura, we do
Okay.
have a couple questions popping in here, so if you want to take a minute, we can do them. Here's the first question. Did you say as part of Executive Order 2020-17 that we are unable to see patients other than the emergency in the office until the state of emergency is lifted?
Yes, but yeah, that order goes until the state of emergency is lifted.
Okay, there's a part
There's
two to
no-
that question. Did you say that as part of Executive Order 17 that we are? Oh no, it's just repeated. Sorry about that. It's just repeated in the question area. There's another question. Does the expanded emergency FMLA expansion include maternity leave?
No. It's for taking
That was
care of a child whose school or daycare is not available. So it would anticipate that the child would already be enrolled in school or daycare. But if their doctor puts them off for pregnancy-related reasons, they could have regular FMLA, but that would not be paid.
Great. Okay. I don't see any other questions at this point, so I think we probably should go ahead and wrap it up.
All right. Thanks, everybody. Have a great day. And again, you got my contact information. Let me know if you have questions or need anything. Thanks for coming.